Strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, TGIF edition, Friday. So really going to give you last of the health knowledge here for the week, but you can always check out everything at allcountyhealthcare.com, all our radio shows, or on the Facebook Live page of All County Healthcare. Tonight we're going to talk about a topic that really haven't discussed too much on this show in the past, and that's wound care and hyperbaric medicine. So those are two topics that I'm really finding fascinating, because I only thought of hyperbaric medicine over the last few years until I got into healthcare for the treatment that involves the hyperbaric medicine, hyperbaric oxygen, when a scuba diver gets the bends. But lately, as I've kind of been on this adventure in healthcare, I've seen that it can treat a whole bunch of ailments, and that's why tonight, this evening, I wanted to have on the program Adrian Diaz. He's an RN, CWS, clinical program director at Hialeah Hospital's Center for Wound Care and Hyperbaric Medicine in Hialeah, Florida, which actually is only an hour from right here, our Boca Raton studios. But as you know, we broadcast from Miami to about Fort Pierce, so I'm really excited to have him on the program. I actually was at his hospital this week, and if you follow me on Instagram, you saw the picture of Jesus doing surgery. Well, not doing the surgery, but having his hand on the surgeon's shoulder, which is in the lobby of Hialeah Hospital, one of my favorite pieces of art in South Florida. So without further ado, I want to welcome Adrian Diaz to the program. Adrian, how are you doing this evening? I'm doing great. Thanks for having me today. Thank you, and you sound loud and clear, so we're ready to go. I wanted to have you on because it really sounds really neat, hyperbaric medicine, but there's a lot to explain with it, and you're actually the clinical program director, so you actually have a program at the hospital that has, and correct me if I'm wrong, these hyperbaric tubes or a hyperbaric center where someone goes in with an ailment, and I guess the oxygen pressurized is able to kind of help with the treatment. So can you explain, I guess, what a wound care center is? Sure. So basically, Wound Care Center is basically a one-stop shop for an advanced wound care that physicians from our team, which is a multidisciplinary team, we have podiatry, internal medicine, and we're in close contact with vascular surgeons, endocrinologists in the community to help these patients with these chronic wounds heal. The Wound Care Center actually allows these physicians to use the most advanced products that are very difficult to get in private offices. These can be like total contact casting for diabetic foot ulcers, multi-layer compression wraps for venous leg ulcers. We have bioengineered skin substitutes and specialized treatments like you were talking about, hyperbaric oxygen for these difficult to healing wounds. We specialize in healing these chronic, non-healing wounds that, despite all efforts, have not been able to close with conventional methods. And it really does take a team environment to help, close these wounds, not only just supplies, but actual, physicians and expertise from the nurses as well. So you oversee that whole center. It's the Hialeah Hospital Center for Wound Care and Hyperbaric Medicine. So take us into the actual environment of the center. So there's doctors working in and out of there. I guess they'd probably be internists, but you mentioned that vascular and other areas, medical specialties refer to that center. But do you also, you're a nurse by medical specialty. Who else is in there in the actual center? So perfect. Yeah, we have the panel physicians, which are physicians that are specialized in wound care, and they have dedicated days out of the week. And in our center specifically, we have podiatrists, we have internal medicine. We actually have quite a few podiatrists because lower extremity wounds in the area is very common. We have nurses, so it's myself and another nurse and the inpatient unit. We're all also specialized in wound care.
The CWS is certified wound specialist. We have a nurse that's wound care certified, and our physicians are also wound care specialists. So, this is like our passion. This is what we do. Physicians, give the treatment, and then the nurses play the important role by applying the bandages and actually coordinating the care from what the physicians want to happen to them actually going home. So that's coordinating home health care, insurance issues, supplies at home. A lot of patients are not aware that insurances provide a lot of resources to them in getting supplies, air mattresses, and all the things they really need at home. So that's what the nurses really, take advantage of.
Wow, sounds like a great team. I wanted to ask you a little bit about the actual equipment in there, because I'm going to be honest with you. I Googled hyperbaric medicine, hyperbaric chamber, and I got a lot of pictures of these. I don't know if these are hospital grade, but these tubes, and it looked like people were almost sleeping in them. And then I saw what I want to say was a few, like you were mentioning, like almost like an air cast or something that kind of enclosed the oxygen over the wound. So what are we going to see in your wound care? It sounds futuristic, but this is really happening. I mean, this is really at the hospital. It's hyperbaric medicine. So talk with us, kind of paint us a picture of what the center looks like in terms of equipment.
Sure. I mean, well, we have two hyperbaric chambers that are both monoplace chambers, meaning that only one person can go in at a time. We have a whole suite that's dedicated to that, and we have the nurse that sits down with them and actually provides the treatment. It's basically a clear acrylic capsule is what I call it for the most part. It has a bed that slides in and out. Patient basically lays on the bed, we slide them in, start the treatment, and what they basically feel is, like they're in an airplane for the most part. The nurse is outside. We control the pressure that the doctors order, and for the most part, the treatments are, well, and I'll go into that too, with how the actual hyperbaric treatments work when you get there. But it's basically a room. You come. It's very comfortable. It's a capsule. They're really space-looking, but they're really comfortable. Most of our patients go to sleep in there, watch TV. And that's what the actual equipment itself looks like.
I was going to ask you about going to sleep, because I actually, and you mentioned airplanes, the first thing that happens to me on an airplane once we reach cruising level is I can't help it. I always fall asleep, and I was looking at some of the pictures online, and I think I would actually fall asleep in your chamber as well. So it is okay to fall asleep and relax while the procedure's going on.
Definitely. And actually, so I'm actually the one that does the treatment, inside the chamber. Most patients prefer it. I always tell them when they get there is I'm going to keep everything as calm, comfortable as possible. You're going to be in there. I can talk to you, perfectly through a phone. I can hear you fine. I control the TV for you. Do you want the volume up? Do you want the volume down? They go in there with a 100% cotton gown. No perfume, no deodorant, no phone, so there's no distraction from the outside environment. You either watch TV or you can relax and actually zone out for the day, which a lot of patients actually enjoy.
That's fantastic. I didn't know there was a TV in there, too.
Yeah, the TV is actually on the outside, so they can watch it. I have a nice little library of movies that they can watch, and we provide that for them.
That's really neat. So yeah, it sounds like a very comfortable setting. And now what? I'm going to jump a little ahead in the questions, but how long is someone in that chamber for? What's like the minimum and maximum that a doctor would order?
Sure. So it's going to depend on the indication that they're actually being treated for. Most treatments are going to be daily, Monday through Fridays. We're open during the week. Treatments are usually about 2.5 hours, again, depending on the indication. And for the amount of treatments you get, again, depending on the indications, can be anywhere between 30 and 60 total. So they're actually with us for a good, month and a half. So it is a commitment. But again, this is an advanced therapy that they know is going to actually, help them get to healed and solve their problem. So, they show a lot of dedication to be there every day.
Sounds like it. And we're here with Adrian Diaz. He's RN CWS Clinical Program Director at Hialeah Hospital's Center for Wound Care and Hyperbaric Medicine. They have a great website. It's hialeahhosp.com. So it's Hialeah, HIALEAHHOSP.com. On there as well. And like I said, I was Googling around. I actually Googled Hialeah Hospital and hyperbaric chamber, and I got a really nice page about hyperbaric oxygen therapy that Hialeah Hospital put out. And then I Googled Hialeah Hospital and wound care, and again, I got a really nice page come up with a ton of information on wound care, actually where I got a lot of my info to ask Adrian tonight, so I didn't look like I didn't know what I was talking about at all. I'm just talking about scuba bends, but great information there, no kidding around. Hialeah Hospital's 305-693-6100, but I'll give you, if you stick around, Adrian's direct extension as well. So if you have any questions, you can talk to him or his team. Adrian, you mentioned a couple times a lot of foot infections, and we get that diabetic foot ulcers, issues with the lower extremities would need hyperbaric medicine a lot. Now, tell me a little bit about how it can help with bubbles of air in the blood vessels. Is that the bends that I've kind of been talking about?
So yeah, that's part of it. There is a couple indications. One is decompression illness, which is one, but the bubbles in the blood vessels is actually the more critical case. And so basically how hyperbaric oxygen works, and I probably better to explain it now, is it works off of Boyle's law, which basically says as pressure increases, the volume of gas decreases. So basically under pressure, these gas bubbles are made smaller and smaller than what they are in normal room air like we're breathing right now. So if you have a trauma or maybe a procedure that there's an adverse event, or maybe even decompression illness if it's severe enough, what happens is that you have a large bubble in a blood vessel that is blocking the flow of blood in it, and the only treatment for that really is to make the bubble small again so it diffuses back into the blood and into the tissue, and then the body can actually breathe it out. And then that's the indication for that. That's the very severe case, and that's very rare, but it's how it's treated because it works on the gas bubbles.
Now, is there any other instances besides scuba diving where bubbles would get into your blood vessels? I mean, can that be something that has maybe come from a ailment or a procedure as well?
Yeah. So maybe an intravascular procedure. They're injecting dyes and stuff like that. Again, these aren't something common, but people have IVs if they ever get air, a large volume of air injected through there. That would be what an air embolism is. I've seen working in another hospital, a patient came in with blindness, and what they found was that there was a bubble inside the optic artery, and it was actually treated with hyperbaric oxygen, and they were able to restore the sight back. But that's a rare, indication, but that is what it's used for, make those bubbles small again.
Wow, it seems like you've seen it all. It seems like we're just talking so futuristic medicine, but I know doing the research, the Navy did a lot with this, and other countries as well with this hyperbaric medicine. So I'm glad to see it come to the forefront. Really is something. Now, we talked a little bit about, diabetic ulcers, lower leg ulcers. I actually talked to a man recently who had a treatment, and he was going to hyperbaric, like on the schedule you said, and he said it was amazing. Now, can it also help with, gangrene, which I've seen a little bit of, skin tears or lacerations on the lower extremities?
Yeah, so diabetes and wound care has been a really hot topic the past couple of years because they're so, intertwined. Diabetics are very prone to getting wounds for various reasons. Diabetes is one of those diseases that goes on for years without really causing any immediate problems. But what happens over time is that it affects their circulation, their immune function, their cellular function, and overall protective sensation. So what happens, and gangrene is a diagnosis specifically given to diabetics that have low blood flow to the extremity, and usually it's always the the foot or the toes. And because of the low oxygen that's there, any little wound that can develop, it basically makes the cells need more oxygen to help heal itself. And because it's not able to get more oxygen from the body because of the poor circulation, it actually turns that, the different color. It gets that black, and that's where people have heard of gangrene. So what hyperbaric oxygen does is it actually not reverses, but helps stimulate all those things. So it helps stimulate and increase mobilization of white blood cells and stem cells. So you're helping cells actually get to that infected tissue, get rid of infection. You're helping oxygen get into areas it wasn't able to before, because, again, you're making oxygen molecules super tiny that is able to actually diffuse into the tissue and the plasma, which normally it's only attached to red blood cells. And you're able to oxygenate that tissue that red blood cells can't get to. So that's how it's bringing oxygen to these wounds to help it start healing. And it also upregulates fibroblasts and growth factors that basically lay down the collagen framework that's necessary for wounds to heal. So diabetic wounds is a big player in today's community. There's a lot of research going into it to lower the chances of amputations. So wound care has really taken a step towards the better in putting research towards these patients that really need these advanced therapies.
We've had a lot of vascular surgeons on the program, so hearing that about amputation, any way we can avoid that is always a great thing. They always tell us that because the mortality rate after amputations, the listeners know on this show, they've heard that from the vascular surgeons. Adrian, hold that thought. I'm going to take a quick commercial break, and on the other side, talk to you a little bit about if hyperbaric oxygen chambers can help with radiation injuries on the How to Stay Healthy show.
Sure.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida and beyond. We're here with Adrian Diaz, RN CWS Clinical Program Director at Hialeah Hospital Center for Wound Care and Hyperbaric Medicine. I'll give out their info one more time if you stick with me. If you have any questions for Adrian, the number is 888-565-1470. I'll have him here till 6 p.m. But I have a question for Adrian. Radiation injuries, that's something that is a topic nowadays because I know radiation is used in a lot of cancer treatments and maybe other things that I don't even know about going on in hospitals. But can the hyperbaric oxygen chamber help with, radiation burn injuries? Is that a burn or?
No, it's the burn itself that's happens from the radiation is going to be a separate issue.
Okay. I was off there. Sorry.
Yeah. So yes, it definitely helps with radiation injuries, and actually the indication is going to be late effects of radiation. Radiation is an amazing tool. As you know, it treats people with cancer. It saves lives. by killing these tumor cells. But what happens is to some people in the years later, the healthy tissue that actually received the radiation actually does get, I guess, essentially burned. And as a result, it can cause problems that later that tissue develops scar tissue, and it actually becomes has poor blood flow, which can cause ulcers. So in these situations, I can give you some diagnosis. So we have that we see in the center a lot, and more frequently now as I go out and do education in the community, is radiation cystitis, radiation proctitis, and osteoradionecrosis of the mandible. So that's basically radiation injury to the bladder, the bowel, and then the jaw. And I did want to give an example because this is something that happened years ago. So they had radiation 4 years ago. They're presenting now to the wound care center, and they have symptoms of, blood in their urine, incontinence, mild bladder pain. And their urologist will basically send them to us to treat these late effects of radiation. So there's not much you can really do in those situations. And hyperbarics has shown to give the best results in helping oxygenate those tissues from the inside out, because the oxygen doesn't really know where to go. It just goes everywhere that it's needed. And being radiated tissue, it's starving for oxygen, and it causes inflammation, maybe some little ulcerations in the bladder that they end up with this blood in their urine. So, that's how the HBO works in those situations. And another actually really big one is the osteoradionecrosis of the mandible, which is the jaw. So anybody that has had head and neck cancer, they had radiation to the area. Now, 4 or 5 years later, they're going to the dentist. They see that their teeth are, have dental caries. They need extractions. And then what happens after the extractions is, they're left with small little wounds that are very difficult to heal. So that bone that's there is, hypoperfused. The radiation kind of burns off the small capillaries that help oxygenate the tissue. So what happens is that any little insult to the area, an ulcer, very difficult to heal after. And there's a treatment actually centered around that called the Marks protocol that basically says that you need 20 treatments before any dental extractions and 10 treatments after. And what that does is help the procedure go as planned, and to oxygenate the bone beforehand, remove the tooth after, and then have 10 more treatments to help close the ulcer. So I've seen that with great success as well. And then these radiation injuries are actually treated at a deeper depth, which is closer to 50 feet below sea level, for a total of 40 to 60 treatments. So they're actually the more intense and needy patients.
Wow. So you treat patients from head to toe. I mean, we were talking about diabetic foot ulcers before. Now we're up into the jaw. That's really amazing. I really feel like, do people ever tell you is this is futuristic, like this type of medicine? Do they feel that way?
Yeah, I mean, the technology is really old. I mean, the way it works is just essentially, like I said, you're just making gas bubbles small, and then you're getting the effects of the oxygen by breathing that, and oxygen at such a high level has all these other qualities like I was explaining earlier. So, most indications is infection, making bubbles smaller, and then just hyperoxygenation. And you think how many things out there need oxygen, and, how can hyperbaric oxygen help them, to heal and solve those problems.
Well, it is fantastic, and you make it really easy to understand, Adrian. I'm sure you've been told that many times, but
I try.
It's tough to get me to comprehend things, and I'm actually understanding this. So I think it's amazing work that you're doing at Hialeah Hospital, and also you're a great communicator. You're bilingual, right?
Yeah, so Hialeah Hospital is in the heart of Spanish territory. So yes, we speak both English and Spanish.
I've been there a few times, and I speak poquito español, but I get by. But no, everyone's so friendly there, and like I said, it's actually easy to hospital get in and out of. Once you get into that parking garage, you're good to go, and I find it very convenient, that hospital. So. Like I said, I've been there many times in the lobby. Like I said about you got to go there just to see that piece of artwork. It's amazing. I'm told that art type of artwork is other places in the hospital, but I haven't been through the whole campus yet. But I'll be back. I was actually there this week with bariatric and general surgeon Dr. Werner Andrade, who's going to come on the show March 16th. So that's next Friday, I believe. Wow. So yeah, we're going to have Hialeah Hospital covered in March. You mentioned before the community. So do you actually, are you available to go out into the Miami-Dade community near Hialeah Hospital and talk a little bit about the wound care? Is that something you do on a regular basis?
Definitely. So yeah, part of my role is I do clinical. So I do wound care center. I do the hyperbaric treatments. But in doing that, I'm actually able to go out and communicate with both patients and physicians. All these indication, all these services that we provide. Because again, it's in the community. They just may not know it exists. They may not know that they have these options. But we exist, and we're here to help them in any way we can. So that's definitely our goal. And as soon as I have an hour to spend, I'm outside trying to communicate those. So yes.
That's great. And tell us again, because we do have physicians who actually watch and listen to this show. Tell us again what type of physicians refer to the Wound Care Center and Hyperbaric Medicine Center there at Hialeah Hospital, or like maybe it could be any, because you were talking about orthodontics or dentists as well, right?
Yeah, because, the indications are kind of, endless. Most common is internal medicine because they see them, the most amount of patients. Patient comes in and says, hey, I have something on my toe. They see it and they say directly go to the wound care center. Like I said, it's a one-stop shop for the advanced wound care. You never know when a wound is actually going to heal. So you're never going to know when you're going to need those advanced therapies, and we have those available. So yes, vascular surgeon, podiatry, like I was talking about, urology, oral maxillary facial surgery, for the late effects indication. So it can really come from anybody.
Okay, and then lastly, I think we got about a minute left. So if someone watches this show and they have a family member or friend who kind of has a wound or ailment, and they have more information, they can call your office directly, or go to the hospital's website, or should they go to their primary care and just tell them that they would like to go to your center?
So it could be all of the above.
Okay.
We always say, go and speak to your primary care physician. It's good that they ask. Patients can call us and say, hey, I have a wound. Do you think you guys can see me? Yes, of course. If they need an authorization because insurance is going to be an issue, we help coordinate that. There's no patient we'll turn away. I mean, a patient that may think they have a wound could benefit from the education that we can provide them, and they may never have to come see us again after that.
Certainly, and it's Adrian Diaz. He's a clinical program director at Hialeah Hospital Center for Wound Care and Hyperbaric Medicine. 305-835-4153, extension 4749, or get his info at hialeahhosp.com. Adrian, thanks so much for coming on the program. I'd love to have you on in the future.
No, thank you. I really appreciate it.
Thank you, and that was so informative. And have a good night, South Florida. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy Show.